Today I'll be talking to you about certain facts and myths about cancer. Cancer is considered as one of the most dreaded disease one can think of, but actually it is not true. It is not only for the patient himself or herself, but it is also a big taboo for the patient's relative and the family. It is not the life of the cancer patient that changes after the diagnosis, but also the whole family members. Early diagnosis and treatment is the key to the cure of cancer patients, but unfortunately in India, more than 50% of the patients, that means majority of the patients, land up in stage 4 disease. Stage 4 over here means that disease is not in a curable stage. Again, I would like to emphasize that early diagnosis and treatment is the key to the cure. The most frequently asked question by the patient and their relatives is that why do cancer happen and why it has happened to them and is it preventable? And the answer is yes, it is preventable, and in most scenarios, as the saying goes, prevention is better than cure. For preventing cancers, there are certain lifestyle changes that everyone should adopt in their life, such as to stop smoking and tobacco use, avoid excessive drinking of alcohol, avoid obesity, maintain a healthy lifestyle, personal weight management, eating healthy food. There are certain cancer screening programs that need to be done, regular mammographies in females, there is a prostate cancer specific antigen for prostatic cancer to be tested every alternate year after age of 40. There are vaccines that can prevent cancer such as human papilloma virus and hepatitis B. Vaccination should be done. And if there is any family history of cancer, patient should be subjected for a genetic counseling. Another aspect of cancer is that most patients ask that it is communicable. That means they want to ask, can it be transmitted from them to their relatives and especially children at home if they have? And the answer to this is no. Cancer cannot be transmitted from one individual to another, and there is no chance that it can transmit to the children also. But 10 to 15% cancers are hereditary. By hereditary, we mean that they run in the family. It can go from one generation to another, and that is because of the certain genetic mutations which are running in the family. Therefore, it is not transmissible from one person to another, but they run in the family, the hereditary cancers. Therefore, it is very important to ask the patient in their family history that is there any cancer history in their mother, father or any relative. Cancer can happen in any part of the body, and the signs and symptoms that happen depends upon the organ of the involvement. Such as in breast cancer, usually females come up with a lump in the breast or a nipple discharge. Patients with oral cavity cancer come up with a long-standing ulcer in their mouth. And these are such symptoms which should not be ignored. If they are not getting healed, then you should be visiting your family physician, and even still, if it is not getting cured, you should be visiting an oncologist for it. In the end, I would like to emphasize that cancer is not a treatment of a single physician or a surgeon. It is a comprehensive oncology team that takes care of the cancer patients, and you should be at the right place where a comprehensive oncology team is there. That means a medical oncologist, surgical oncologist and a radiation oncologist all have to be in the same place taking care of you so that they can give you the best chance of cure.